Type 2 diabetes mellitus is a chronic disorder that affects how your body processes sugar, or glucose, for energy. It involves multiple body systems and has minor and major effects on their functions. The organ systems which are primarily associated with complication of type 2 diabetes are the endocrine system. The pancreas plays a crucial role in type 2 diabetes. It produces insulin, a hormone that regulates the blood sugar levels. In type 2 diabetes, the cells in the pancreas have an altered production, or the body cells does not respond effectively to insulin. This leads to insulin resistance and elevated blood sugar levels. In type 2 diabetes, the body's ability to regulate blood sugar is impaired. The liver may produce too much glucose, and muscles and fat cells may not take enough glucose from the blood, causing hyperglycemia, or high blood sugar. Cardiovascular system. Diabetes significantly increases the risk for cardiovascular problems. High blood sugar levels can damage blood vessels and increase the risk for hypertension, heart disease, and even strokes. Also affects the nervous system. Elevated blood sugar levels can damage nerves over a long time, leading to a diabetic neuropathy. This can cause tingling, numbness, and pain, mostly in the legs and feet. Also, renal kidney system. The kidneys are responsible for filtering waste from the blood. In diabetes, the kidneys become damaged, leading to diabetic nephropathy. Other systems that could be affected include diabetic retinopathy, diabetic ulcers, gastroparesis, and muscle stiffness. Type 2 diabetes is centered around insulin resistance. Insulin resistance occurs when the body's cells become less responsive to the effect of insulin. As the result, glucose uptake these cells is impaired, and they require more insulin to transfer glucose from the bloodstreams into the cells for energy. Over time, cells in the pancreas called beta cells become dysfunctional and are less able to secrete insulin in response, raising sugar levels. Next, glucose uptake the cells is affected because patients consume glucose, but cells struggle to take it effectively, which leads to elevated blood sugar levels. The liver is also affected in type 2 diabetes because it may produce excess glucose even when the blood sugars are already elevated. If the body is exposed to high blood sugar levels for a sufficient period, the levels of free fatty acids in the fat tissues increases, which further worsens the insulin resistance. As a result, patients are present with hyperglycemia, low insulin levels, and elevated lipid levels in their bloodstream. Type 2 diabetes often develops over an extended period, and many people may not notice any symptoms into early stages. However, there are some signs that could be indicative of diabetes. These early symptoms may include fatigue, increased thirst, frequent urination, tingling or numbness, increased hunger, weight changes, skin changes, slow wound healing, and blurred vision. It is important to note that not everybody with type 2 diabetes will experience all these symptoms, and some may not even be noticeable until the disease has progressed. Regular medical checkups and screenings are crucial, especially for individuals where there's family history of disease. CNAs are a part of the great team of professionals who are essential for providing the best medical care for patients struggling with type 2 diabetes. CNA's roles in supporting individuals with type 2 diabetes include assisting with the multiple aspects of their care, such as blood glucose monitoring. CNAs can assist with blood glucose monitoring, ensuring that the patients are set to control their blood sugar levels, that are using proper technique, and that they are keeping an accurate track of their measurements. Also, assisting with medication management and healthy food intakes, CNA can help their clients with type 2 diabetes take their prescribed medication as scheduled, including oral medication or injections. Type 2 patients need to practice balanced diets with low glycemic index foods. In addition, food needs to be taken at a corresponding to medication or insulin to maintain the proper glycemic clock. CNAs can assist by educating patients on healthy food choices and portions and assisting with meal prep and feeding if needed. Measuring vital signs may seem trivial, however it is very relevant in type 2 diabetes patients because hypertension is often associated with the condition. CNAs can assist with regularly measuring and recording vital signs, including blood pressure, pulse, and respiratory rate, and alert if any changes or trends are seen in the patients. Patients with type 2 diabetes can experience increased thirst and frequent urination, and some of them might exhibit renal failures. CNA can assist first by making sure the patients stay adequately hydrated. This can be done by offering water and moderating fluid intakes more frequently, but also need to pay close attention to any indication of renal complications. This can be a lack of urine in the urine bag, lack of urination, or change of urine color or cloudiness. Patients with type 2 diabetes may have impaired visions as complications of the condition. CNAs can assist in making sure patients in hospital settings are safe from potential falls and injuries, since these can be more problematic for individuals with certain type 2 complications such as neuropathy or retinopathy. Diabetes is a challenging condition, which can start slowly but can quickly escalate to multi-system conditions. CNAs can assist patients by offering emotional support and listening to any concerns the patients may have. They can encourage the patients to take part in regular physical activity even if it's very minimal, such as walking or static exercise. Patients with type 2 diabetes oftentimes suffer from peripheral neuropathy and lower blood flow in the extremities. CNAs can assist by paying special attention to patients' feet and provide daily inspections and hygienes. Individuals with diabetes are at high risk for foot ulcers, which, if not detected in time, can cause complications and even result in amputations. CNAs should inspect and report any signs of wounds or skin changes in the patients with type 2 diabetes to the team.